research out there connecting plantar fasciitis to TMJ, temporomandibular joint dysfunction, to where if I put arch supports in some people's shoes, I can actually help alleviate TMJ symptoms. That's getting to a point that I have a hard time following at times, but the research is, there is some out there, people looking at those connectivities from the head to the foot. So recognize that just because we're shifting upper to lower and then focusing on mid-back, these things are continuous structures. They're not just singularly identifiable all the time. Superficial fibers cross contralateral side and attach to the sacrum, the PSIS, iliac crest, continuous fluid. So poor posture, thoracic kyphosis. So if I increase my kyphosis, if you take that gear and crank it forward, then for me to see where I'm going, I have to increase the lordosis within my cervical spine. So you get a forward motion here, and you have to crank the neck, the cervical spine even more. Which means we're altering even the length that the trapezius muscles are going to have to run to control a head-up position. So you're going to have increased tensioning through here because you're effectively shortening that distance. But if I'm cranking that kyphotic curve, that thoracic curve, it's going to end up having to balance my body weight by increasing lordosis, lumbar curve. It could be that the lumbar curve is actually increasing the kyphotic, but you get they're all interconnected gears that are kind of shifting in response to the ones above. So, TFL. 3 layers fuse to form the dense raphe where the rectus abdominis begins. So those TFL fibers come out and forward to give us a lot of this ligamentous fascia, which is where we begin the rectus abdominis. So musculature. Well, we've talked hamstrings, glute max, and iliopsoas in the past. So we're going to focus a bit more on our erector muscles now. So latissimus dorsi, we know. We discussed it quite a bit in terms of upper extremity because that's where its primary function is on the humerus. What's the function of the lat dorsi?
Adduction and rotation of the
Adduction, adduction, so it's pulling inwards. And actually the way it inserts, it has internal rotation force, right? So it's internal rotator and it's got an adduction pulling your arms down. That's what we call lat pull downs with the machines. They're primarily put into play when we're doing pull-ups as well. So rectus abdominis, quadratus lumborum, iliacostalis lumborum, longissimus spinalis. So there's your lats. Nice pretty picture. Again, you can see how these fibers, the originating tendons through here, actually just intermix within the ligamentous support as well as the thoracolumbar fascia. And it kind of clips over the tip of that inferior angle on some. Either that or the thoracolumbar fascia helps articulate with that, but it's not a direct connection. It doesn't actually insert or attach to the scapula beyond the fascial fibers that may extend in. Rectus abdominis, this is your sexy six-pack abs. All right, this is what everyone wants to get a hold of. If we can really tone it down, we can go for the 8-pack abs. But, you know, the last time I saw that was like on a 12-year-old who didn't know what the slow metabolism was. I prefer going by the term of calling them washboard abs, and I just like to say they might have a load of laundry on them, so I'm working on it. We're getting good. So, quadratus lumborum, it goes from iliac crest into that bottom 12th floating rib. This is your really cool belly dancer muscle, to where like shifts. If you missed, you missed. I'm sorry.
Someone time thing.
That'll be on your final oral exam. I expect everybody to manual muscle test quadratus lumborum for you. But again, it helps stabilize, it shifts, it connects that lower rib cage with here. So this is where we start getting into some conversations of core activation, core strength. Where we're having musculature that's connecting the upper half, the upper lobe with the lower half. Now this is not one of my primaries, but certainly is going to contribute. The glutes we've discussed a lot before, iliopsoas intrinsic, and that's where we're going to go here. So I'm going to switch PowerPoints because it's much more visual if I can get it here.
Ooh.
All right. So laminar group. What's the lamina?
It's the pedicle laminas in between the transverse process and the spinous.
So we've got that groove that's going to create, it's the extension from the transverse forward to the spinous, so we're going to have a groove right here.
Yeah.
So at this point, I want desks clear. And we're going to do palpation to get through these.
It's like there's a pedicle and there's laminas between transverse and the spinous process.
Decided I need a set of yoga mats. Just because that's just not the nicest. Face pillows would work nice too.
These are my yoga pants.
Those are your yoga pants?
Chita,
What'd you do, fall down? Going through a flood?
Here, let me.
Did I save that?
Do we have to clear this one?
I'll move.
Are you showing me a model?
No, I'm right.
This one's on
Sorry.
This is the problem when you get an ass. All right, so I need one happy person lying on this numbers. Right.
Vamos a mirar Entonces, Alright, you go, because I'm recording.
Oh, you want me to get him?
My bad.
Elbow. Happy birthday. All right, so on your stomachs, first thing I want you to find me some, I want C7.
C7? So the
Dude, that sounds like a bicycle.
clavicle's right here.
I need it built into a hoodie, so you can just throw the hoodie on. Good to go. All right, so
Right here.
C7. C7 is the most prominent cervical,
It's right here somewhere.
prominent vertebra right here at the base of the top of the neck.
Yeah. Oh, I was close. I went over
Nah,
here.
you were all the way over there.
Where was it? Right here?
It's the most prominent.
Below that, we're going to drop into thoracic, right? We have 7 vertical, 7 cervical.
Yeah.
So somebody asked me the question real quick.
Is this it right here?
If we're doing brachial plexus assessment,
That's right here. Alright.
what is this? What is this?
Ulnar deviation, C8.
Radial ulnar deviation.
Good, that's C8, right? Why do I have a C8 if I only have 7 cervical vertebrae?
That was months
Dude,
ago.
I was going to ask you that the other day.
Isn't that wait? That's how they split up in like nerves, right?
Confuse you.
What was that? What was the question?
Why do you have a C8?
Is it a brand?
Yeah, there's an extra brand.
Why do you have a C8?
Depends on where you start counting from, right? So 7th cervical vertebra, the branches that come out of it at C7 are above it. So there is one below, except with T1 we switch and go below.
So it's the same as T1?
It's no, they're different. So, but it's the space between C7 and T1. And from T1 we start going below. Beyond that, I can't tell you what. So, spinous processes. Find a C7, work your way down. Now, once you actually feel across to find the transverse processes as well. So, book and prod, find that laminar groove.
Okay.
Because that groove right there really is just cradling musculature. It's a space for it to run. So this is one of those times if you don't know what I'm talking about, ask me so I can book and prod and drop.
That's cool.
Yeah? Yeah, okay, so
Yeah, I can feel it.
C7, well, any of them, really, so you're find spinous processes. And if we want to find transverse, you're gonna come out finger width. I mean, we're talking vertebra. We're gonna go transverse, you're gonna have a space between. You got it? So we're looking for,
sure.
this is gonna be a little hard, because these are gonna be covered up by muscles quite a bit. It's a little bit easier when we get down here, but regardless, so your spinous process is through here, you can feel them coming down.
Is
count
that
them if
the
you want.
spine? That might be the spine.
But if you get right in there, you'll start finding
Yeah, this is the
the
spine.
transverse process.
I mean the scapula.
See where that, the ribs are kind of up and around.
That's
So that squishiness
Where is
right there
it?
is all.
Okay, so that is the transverse. Okay, I feel it. It's all this right here.
Is this, you're gonna feel the muscles,
¿Cuál es?
not the groove, because the muscles
En
are.
la espina. Vas a venir
¿Este
como-
cuál es?
Alright,
This
so,
is the process, the spinal process. Spine.
the deep part of
Vas a
this,
venir
the
más
deepest
para acá.
of these, we have
Okay.
two very small sets of muscles. We have multifidi and rotatories.
It's the transverse process.
very crazy.
Ahí
These
se
are
para.
rotational muscles and supporters. Now, rotatores are going to be more horizontally oriented because they're going to create a rotation, twisting from one spinous process